So let's talk about medical emergencies, right? You're overseas, you're abroad, you're accustomed to your normal health situation back home. Maybe you know which emergency room to go to, which urgent care to go to, which walk-in clinic to go to. And now in this foreign place, you were thinking that this could be a medical emergency and you need to go, or you need to call emergency services. So what to expect, what could happen, what could go wrong? Let's talk about that. Number one, how do you recognize a medical emergency? Number two, when you do get to the emergency room, how can you make sure that you can advocate for yourself and that you're getting the right treatment? So number one, recognizing a medical emergency. I, as a physician, categorize things into three different buckets. Something that is an emergency, it's emergent. Something that is an urgency, it's urgent. And something that's primary care. Primary care meaning it can wait, it can be prevented, or the patient can wait and see if the symptoms might even go away. An emergency means there is an imminent threat to your life or to your health, right? It means you could die, or you could lose an organ, you could lose an eye, or something really permanent could happen, which would become the morbidity part versus the mortality part. Urgency is when something can't wait to go to the primary care doctor or to your regular specialist, to your gastroenterologist, gynecologist, or a family medicine or internal medicine doctor. So it means you're really trying to get seen that day, at the most the next day, but there is no immediate threat, meaning you're not sure that something really dangerous is happening or you're about to have something permanent happen to your health, right? And then primary care means you just need to wait. Sometimes you have to wait a long time. And our healthcare systems in Canada and the US, Australia, UK, it's tough. It can take a long time to be seen. Now, in the US, not as much because you have a lot of private options. So you can immediately pay and get seen. And that's something that we should discuss right now, right? If you are in the US versus some other countries, even if you don't have private health insurance or you only have some sort of public coverage, you can always pay cash to go and see the person whom you think you should be seeing. And now that's even true in a lot of other single payer systems, Canada, Australia, UK, Spain. There are private physicians. If you pay out of pocket and you're willing to pay, you often can be seen much faster. So usually an emergency room should be reserved for an ambulance, meaning if you are going into the emergency room and you don't genuinely have an emergency, meaning you have a cut, but the tendon's functioning, there's no signs of loss of blood flow to the digit, if you can wrap it up and wait till the morning to go to the urgent care, that could still make more sense than going into the emergency room. Because is it really an emergency, right? It's a convenient thing to go to the emergency room. And I say that because there are risks associated with going to an emergency room because you're getting care at a very high level. Mistakes can happen, etc., etc. So recognizing an emergency, if you're having any kind of chest pain, to me as a doctor, middle-aged gentleman, physician, any kind of chest pain that you don't know what it's from, to me it's worth it to go call 911 or call an emergency hotline. If you're having sudden onset shortness of breath, you're like, it could be my anxiety, or the chest pain could be from a pulled muscle, but I don't know. Call 911, call the emergency, put that pressure on them to figure out what's going on. Sudden vision change, sudden loss of function of a limb, sudden weakness, fainting, sudden onset headache that you've never had before. To me, these are emergencies. Even though 99% of the time, probably not, 90% of the time, it's going to be nothing. I would rather have my patients triaged in an emergency setting by somebody who can recognize an emergency and then have them be reassured, right? Even with your children, it's the same thing. Sudden onset rash with very high fevers and child is acting differently. It's an emergency. The urgent care part is kind of simple, right? It's not severe enough to be in the emergency room. It's not really that simple that you should wait, like that cut that we talked about, or this really bad abdominal pain that's keeping you up, or this nausea vomiting thing. Those are great for walk-in clinics or urgent cares. Now, many primary care doctors will have some walk-in clinics to assess and address urgent issues, and other locations are just going to have urgent cares. That's the first part. Now, the second part that what I want to talk about is how can you be your best patient advocate and make sure that you're getting good outcome. The number one most important thing is to make sure that you're going to the right setting for the right thing. If my patient comes in to me into the urgent care and says, I've had 7 years of knee pain, what should I do? I'm probably going to do a joint injection. Is it a good idea? No, it's not. It can degrade the cartilage. I could cause an infection. I could cause a hematoma. I could increase their blood sugars. A lot of complications can arise, but they're in the urgent care and there's an assumption or an understanding that they're there because they just can't tolerate it anymore. So ideally, if you have 7 years of knee pain, you really want to go to the primary care doctor. You don't even want to go to the orthopedic doctor because the orthopedic doctor is going to see you as a potential surgical candidate. You want to go to the primary care doctor, the family medicine doctor, good family medicine doctor, good primary care doctor, or even a sports medicine doctor who's not a surgeon. Even then, I'm concerned about that. You want to go to somebody who is not going to profit from you by performing a procedure or doing something to you, but somebody who instead can empower you, educate you, and share with you their thought process. So speaking of sharing a thought process, when you go to the emergency room and you're capable of communicating, if somebody comes in, you're going in for severe abdominal pain, you're writhing in pain, you're vomiting, maybe you even saw some blood in the urine or whatever, you're going into the emergency room, I don't know what's going on, doctor, please help me. And the doctor just disappears and wants to do a bunch of stuff. Whoa, doc, sorry. Could you please tell me what could be going on? Can you tell me what, if you can give me something for the pain until we can communicate, that's fine if you think we can. No, that's what I was going to do. I was going to give you a shot of injection for pain. Okay, that's fine. Can you please explain to me what you were going to give, what you were thinking, what the alternatives are? A good doctor will do all of that. A bad doctor can't communicate with you, doesn't want to communicate with you, gets upset at you, and you don't want that kind of physician. If you're in an emergency room, unfortunately, sometimes you just don't have the option. One option would be to become friends with a nurse, right? Be really courteous, be really patient, be really kind, because these are the people who deal with really difficult stuff. They get yelled at all day long, so you probably want to be on the nicer side. Or immediately call a friend to come over and say, hey, can you be my advocate? I don't know what to do. I'm in a lot of pain. The doctor doesn't seem to be listening to me. Don't paint him as a bad person, because then your advocate is also going to stand up and maybe cause a ruckus. But instead, just communicate with your advocate that, hey, I don't know. I'm trying to. The doctor seems really busy, or maybe I said something, but I just really need to know what's going on. Most emergency room doctors are really good, believe me. And if you go and you communicate with them, say, I just really want to know what my options are. What do you think this could be? What's the worst thing this could be? And what is it definitely not? What tests were you thinking of running? Do you think I can wait to be seen tomorrow? Do you think I could take something for pain and wait? Do you think there's an immediate risk? And somebody says, no, I think your kidney is dying. It's necrosing. This is an emergency. We have to get a CT scan. Okay, got it. Thank you. Is there any risk to this? Anything I should know about the CT scan? Even if you think you know what the risks are to the CT scan, do not pretend to be a knowledgeable patient at that point. Play dumb, because you want that person, the clinician, the physician, the PA, the NP, whoever, wherever you are in the world, to explain things to you. One of the worst things you could do, even as a doctor, is to pretend to know what you're talking about and what you know, because things get lost in translation. Let the doctor, let them treat you as a patient, and whatever you think you know, have that confirmed once the physician communicates that with you. That's really critical. That's really important, and it will protect you. It will help you. Doctor, what can I do? Can this wait? Where should I go? What about follow-up? Do I need any medicine? How important is it that I take this medicine? Well, that's not really that important, the antibiotics. I just give it precautionary. If I don't take it, am I probably going to be okay? Yes. In medicine, whenever possible, you want to avoid all interventions, including medications, antibiotics, procedures, x-rays, everything. So that's the communication style you should adopt. Ask a lot of questions. Ask where to go for follow-up, whom to see, what could it be, what could it not be? Can you please write those down? Can I write it down? Can I record? Can I leave my phone on here to record while we're having the conversation? Can you bring in a translator? Can my friends come? Is there a nurse that maybe I can talk to? All of these are great